Nutritional therapy for the diseases of the liver, gallbladder, and the pancreas. The first one is the liver. Hepatitis and inflammatory of the liver. The following are the four types of the hepatitis. The first one is the hepatitis A. Is caused by a virus transmitted by a fecal oral route, usually through ingestion of a contaminating food or with anal or oral sex. The second is hepatitis B. Is caused by a virus that can cause both acute and chronic hepatitis. Known transmission of the disease are through blood transfusion, tattoo application, sexual intercourse, contact with blood or bodily fluids, or via the mother to her child by breastfeeding. However, the source of an infection cannot be determined in about half of the cases. Blood contact can be occurred by sharing syringes in intravenous drug use, shaving accessories, or touching wounds on affected persons. The third is the hepatitis C. Is caused by hepatitis C virus, a virus with an RNA genome that is a member of the Flaviviridae family. It can be transmitted through blood contact or sexual contact and can also cross the placenta. Hepatitis C may lead to a chronic form of hepatitis, leading to a scarring of the liver called cirrhosis. It can remain asymptomatic for 10 to 20 years. Hepatitis C patients are susceptible to severe hepatitis if they contract either hepatitis A or hepatitis B. Hence, all affected patients should be immunized against hepatitis A and hepatitis B. They should also avoid alcohol. The last one is the hepatitis D. It's caused by hepatitis delta agent, which is similar to a virus. And for the treatment, rest and optimum nutritional therapy. Diet therapy. The first one is a protein. The diet should be enriched with foods that are concentrated sources of protein. The second one is energy. Whenever the protein allowance is increased, the caloric level of the diet must be sufficient to meet the body's energy needs. The third is minerals and vitamins. The foods added to the diet for protein also increase the intake of calcium, iron, and B-complex vitamins. The fourth is moderate fat. 80 to 10 grams of fat should be provided daily. Hepatitis E produces symptoms similar to hepatitis A, although the process can be fulminant in some patients, particularly among pregnant women. Cirrhosis is a chronic degenerative disease in which the buildup of fibrous connective tissue replaces the liver cells following fatty degeneration of long standing. It can cause the liver cells to die and form new cells. For treatment is rest, supportive care, and nutritional therapy. Diet therapy. In severe cirrhosis of the liver, a serious complication of ascites or fluid in abdomen. Diets restricted to 250 mg sodium may be prescribed in an effort to control the edema. Patients with cirrhosis of the liver are often depleted of protein. A protein intake of 100 grams at a sodium level of 250 mg as possible. When low sodium milk in the 500 mg sodium, 1,800 calorie diet plan is used. It is no longer believed necessary to restrict the amounts of fats in patients with cirrhosis of the liver. And lastly, alcohol is strictly forbidden to avoid continued irritation and malnutrition. Hepatic coma happens where there is too much ammonia in blood circulation. The brain is especially affected and the patient becomes tremulous, disoriented, confused, and lapses into coma. The condition sometimes occurs in patients with severe cirrhosis of the liver. For treatment is nutritional therapy. Diet therapy, high calories about 1,500 to 2,000 calories to prevent tissues catabolism and the liberation of additional nitrogen. The second is the gallbladder. Cholecystitis refers to the inflammation of the gallbladder, which might result from either the formation of gallstone blocking the cytic duct or infection of a gallbladder. It is very common among people consuming high fat and calories. Two types of stone: cholesterol stones and pigment gallstones. The treatment are nutritional therapy and reduced discomfort. Diet therapy. Low-fat diet may be used to avoid stimulus to the gallbladder which constricts to excrete bile with subsequent pain. Rich pastries, chocolates, nuts, and fatty, fried, and gas-forming foods are avoided. Plain and simple foods are recommended. And lastly, spices and high-residue foods must be avoided as they may cause distension and increase peristalsis. Food restricted: whole milk, cream, ice cream, cheese, fatty meats, fish and poultry, chocolate, fried foods, gravies, cooking fats, lard, and most baked foods like cakes, cookies, donuts, pastries, pies, and sweet rolls. Food limited: lean meat, egg yolk and butter, margarine, salad dressings. On food preparations, meat should be lean rather than marbled with fat. All visible fat must be trimmed off. Vegetables cannot be dressed with butter, margarine, or sauces. Lemon juice, vinegar, and herbs lend variety to cooked vegetables. Vegetables and fruit salads may be included, but only lemon juice, vinegar, or low-calorie, fat-free dressings should be used. Honey, jellies, or preserves instead of butter may be used on bread.